personalized. Health insurance was like a personalized health insurance. This is Consumers Doctor, Dr. Bengal. Today's topic is present day atmosphere regarding the health care. Don't be fooled. Don't be fooled. It doesn't take a rocket scientist. Political health reform proposals are typically very confusing on purpose. It's political sleight of hand. So don't be fooled by politicians. Don't be fooled by the health industry lobbyists. They try to sound smart by purposefully making things complicated. One trick they use is to point the finger of blame at someone else. At someone else. Yes, we have a dysfunctional healthcare system, folks. We have a dysfunctional healthcare system. Insurers blame the hospitals and doctors, and hospital blame the insurers. Doctors blame the lawyers. Employers blame the non-compliant employees. Politicians blame other politicians, and so on. Blame goes on with no solution. Yes, there's no solution. Another trick they use is on purpose. Comprehensive solutions. They propose comprehensive solutions. In 2019, healthcare spending represented 17.8% of our gross domestic product. Any industry that large has lots of lobbyists and vested interests, folks. They suggest comprehensive reforms. You know who suggests comprehensive? They suggest comprehensive. Comprehensive solution include so many extra items that everyone is against some part of the comprehensive plan. So nothing gets done. They assume we are stupid to understand the details. They use the industry and political shorthand like COB, CON, HTHP, CDHC, and in many more insider terms to reinforce that we couldn't possibly understand complexities of healthcare. That's how they project. They make it look like it's too complex. It doesn't take a rocket scientist to know the differences between health insurance and health care. Health insurance and health care. Both of them are intertwined. Health care is when one receives the services from medical providers like doctors and hospitals. That health care. Health insurance is how one finances the care, medical services. How we finance the medical services. It's as simple as that, folks. How do we finance the services? That's health insurance. Health insurance reform should focus on private market coverages, but they don't. They about 176 million Americans have access to health care through employer-sponsored health insurance, through individual health insurance policies. 176 million folks. So quite a large number have already have the coverage. Whether it is employer sponsored or individual coverage, we are all concerned about everybody. All the consumers are concerned about three things: cost of the health insurance, that is premium, coverage of the pre existing conditions, number two, and number three, out of pocket expenses. These are all Americans are focused on these three things. But the atmosphere is such, it doesn't take a rocket scientist, doesn't take a rocket scientist to get these three things achieved. Consumers want health insurance, which is affordable, and they want coverage of the pre existing conditions, and they want to know what their out of pocket expenses. Even if you really look at this, advertisements you see on the TV, like Medicare Advantage, they give you free this, free dental, free eye checkup, free, no copays, zero this, zero that. That is all hardwash, folks. Basically, what they're, and a surprising thing is, they don't, when you see the ads, they don't put their insurance company. They just put it in a call so and so number. We'll give you the premium. They're not transparent. It just doesn't. Consumers want to know what their premiums are, but this Medicare, what they're looking at handouts from the Center for Medicare, like a CMA, Center for Medicare. They are giving our money away to these intermediary organizations. So they are looking for a handouts from the government so they can take the money and curtail all the services like co-pays, deductibles, and no, you cannot see your own doctor. You have to go to this particular group. They limit all this stuff, but they're taking your money from Medicare. Center for Medicare Services, CMS, and the Medicare payments are appalling. These CPT and DRG codes all made up numbers, and all the private health insurance companies follow whatever the Medicare says. It's a game. They play this game. These insurance companies and the intermediaries, they want to take the money from CMS, Medicare's, and they take that money and they get a full risk contract, and when it comes to providing the care, they're trying to curtail the services. Why doesn't the Medicare, if AARP is listening, AARP, which is the largest